Now, please welcome Vice President of Walmart Health, Marcus Osborne.
So I was stopped in the lobby of the casino last night by a guy who I think was a little drunk, and he said to me, "Hey Walmart, it looks like you've been busy. It's about time you did something in healthcare." And frankly, I was a little offended. I mean, we're the guys who launched the $4 generic program. We supposedly impacted the pharmacy business. But I simmered down a little bit and decided that, maybe he was right. We actually have been busy. Certainly, we recently launched Walmart Health, the first integrated healthcare service delivery solution at retail. We launched a program that I'm really proud of, a program where for our current associates, they can take classes and earn degrees, healthcare degrees, up to 9 different healthcare degrees, and the cost is only $1 a day. And we've actually seen, that's been the greatest amount of uptake that we've seen amongst all of these academic programs for our associates. We launched a program in Sam's Club, a membership program where if you sign up to it, it entitles you to get discounts at an array of healthcare services. You can get discounts on labs and dental and vision, but what's most interesting is it also has a benefit in telehealth, where you can have a telehealth visit and it only costs you $1. And then lastly, we announced a program, our high value provider network program for our associate plan, health plan. And in that program, it really takes what we started in our centers of excellence over 2 decades ago and takes the learnings from those centers of excellence and creates a program where we now can actually help our associates find high-value providers, the very best doctors in their communities to go to. It helps them find the doctors who deliver the most appropriate care at the highest total quality at the lowest total cost. It helps them find those doctors who aren't going to do unnecessary knee scopes and spinal fusions and C-sections. It helps them find the doctors who aren't going to deliver inappropriate cancer treatment. So we have been busy, and the question is, why? Why have we been doing what we're doing? Why now? Why this? And I think the answer is actually quite simple. For us, it's really all about the customer. And when you ask customers in America, what are you concerned about? What is your biggest point of angst and stress and frustration in your life? It's not the economy, it's not jobs, it's not housing, it's not fear of terrorism, it's not immigration, it's not the dysfunction of DC, it's actually healthcare. And when you ask the question, well, why healthcare? What is it about the healthcare system that actually is causing so much angst and stress and pain? We hear 3 things. It's about cost, it's about convenience, and it's about care. What we hear is, from a cost perspective, the healthcare is just way too expensive. That the cost of health insurance, the cost of medical care, the cost of pharmaceutical products, it's all too much. And when you add in the complete lack of transparency around pricing, it's a perfect storm. So what you see is, in the last year, over half of consumers have said that they either deferred care they needed or did not get the care they needed because of the cost. I think about an experience that I had with a woman about 2 months ago, where she shared that her mother had had breast cancer, her grandmother had breast cancer, but she herself had never had a breast cancer screening because she couldn't afford it. Then you move into convenience. The view is the system is just wildly inconvenient. Why can't I get what I want, when I want it, where I want it, how I want it, in the way that I want it? Why does it feel like things are organized based on the interests of the providers or the payers instead of the interests of me as the consumer? And what you see today is that sort of pops up. There's a lot of facts that support this. The average individual, average consumer has to wait 3 weeks or more to get a primary care visit in the US. But I'm sort of reminded again of an experience that I had with a woman about 2 years ago. I was down in South Texas visiting, and a woman came up and shared. She was a mother of 2, and she was enrolled, or she was on Medicaid, and she shared that to get on a panel for a primary care physician, to be able to get appointments for her kids, she had to wait 2 years. And then when she was finally on that panel, to actually get an appointment scheduled, it took her almost another year. And we wonder why she uses the ER to get care for herself and her family. I think we know why. It's inconvenience. And lastly, this concept of caring. What we know and what we see is this, is that the healthcare industry just doesn't seem to care. It's designed to be complex when it should be simple. It's designed to be unsupportive when it should support. It's designed to provide poor service. And instead of consumers feeling empowered, what we actually have are consumers who are frustrated and alone and often scared. And again, the facts hold. Only 40% of Americans who received care in the last year can say that the care they got, they felt like they got a good service. And if you ask those 40%, did you get any care during the year that you felt was poor? Almost all of them say yes. And I think about the experience of a mother that we saw not too long ago, who came in very stressed, with some, I think, tears in her eyes, and she shared that she was just told that day that her kids can't go back to school the next day unless they got their shots. And her challenge was and so she had her kids with her, but she also had her mom with her. And she was caring for her mother who had dementia. And all she wanted was somebody who would help her get her shots, help her kids get her shots, let her come in the room, but also would help take care of her mom. And she couldn't find anybody to do it. And so that's the challenge. The result is we have a system that is high in cost, inconvenient, uncaring. It's the one that we've all designed. It's the one that we all work in. And the result is it's quite dangerous. We know that consumers believe the system is intentionally trying to keep them from getting what they need for themselves and their family in order to perpetuate the current results. And the result of that is the kind of most egregious reality, that consumers aren't getting the care they need and often generating higher costs downstream. So our challenge is pretty simple. Is it possible to deliver a consumer experience in healthcare that attempts to fully and unabashedly address the concerns Americans have with the healthcare system? A solution that focuses on lowering costs, improving convenience, and that actually cares. Even crazier, is it possible to deliver an experience that delights in healthcare? So that leads us back to Walmart Health. And I bet most of you, in fact, I would ask you to raise your hands, but I won't see barely any hands go up. I bet most of you have never been to Dallas, Georgia, a rural suburb on the northwest corner of Georgia, about 45 minutes from the Atlanta airport. I suspect that most of you will probably never go to Dallas, Georgia. It's not a place that you just end up, right? So what I thought I might do today is I'm going to bring you to Dallas, Georgia. I'm going to take you on a tour of the Dallas, Georgia Walmart Health site. And if we could start the video, that'd be great. So while we haven't figured it all out, I can tell you we've not even gotten close to figuring it all out. We are doing work that's leading us on a journey to create a solution that we hope will get us there. And it's based around a simple premise: deliver the basic services that people need and want for themselves and their family, do it in a way that they can afford, and get those services to actually work together. Have them be delivered in a way that delivers true integrated care. So here are the components of Walmart Health. The first is it involves a broad set of services. We start with primary care. When we say primary care, we mean primary care. It's not just about acute needs, but it's about addressing the chronic needs that people have. So addressing the needs of diabetics and creating a home where they can get care. And it's about addressing the needs of children and adults and seniors. It's actually about bringing a full diagnostic suite. It's about bringing labs and imaging, X-ray, EKG, ultrasound, so that we can deliver direct care, but also so that we can provide extended care in the community. So if there are other providers who want us to facilitate care, we can do that. It includes behavioral health. How many of you are stressed, anxious, depressed? Well, good news. You can see a therapist in our center. It includes a full array of ancillary services: vision, hearing, dental. When we say dental, it's not just preventative care. We even do procedures. If you need a crown, we can do it for you. And we're using the latest technology that enables us to fulfill your needs immediately. So you come in, we can print the crown on demand, and within 15 minutes it's ready for you. You don't have to come back in 2 weeks. We offer services through a community wellness room, silver sneakers classes for seniors, fitness classes for adults and children, nutrition classes for the community, life with baby, new mom classes. The idea of being, we bring and address the community wellness and group needs in that venue. We have healthcare financing solutions. Do you have questions about health insurance? Take Medicare. Are you eligible for Medicare? If you are, what's the difference between Medicare fee-for-service and Medicare Advantage? Should I enroll in a Medicare Part D plan? Should I enroll in a Medicare supplemental plan? If you can answer that question, you probably are in the 0.1% of all Americans. And that's a big decision and a big question. Those are big questions to get answered. And so we create a venue where you can come in and ask questions about Medicare, Medicaid, ACA, and other things. You can also enroll in plans. And lastly, we're bringing in even more services. So for example, we brought in, using a mobile modality, access to women's health services. So those are the services. We're also about delivering a simple pricing approach. We take insurance. But if you don't have insurance, or your insurance isn't particularly good, that's okay. A primary care visit, a basic one, is only $40. If you need a vision screening, it's $45. If you need your teeth checked, you need a dental exam and an x-ray and a teeth cleaning, it's $50 for all of you in the room, and if you have kids, it's only $40. And back to therapy. If you are stressed, if your boss is terrible and is wearing you out, or if your spouse is wearing you out, or your kids or your mom is wearing you out, good news. All of you and everybody you know can afford to have therapy because it's only $1 a minute, so $60 for 60 minutes. And it's convenient. Open 7 days a week, 80 hours of operation, 7:30 to 7:30, Monday through Saturday, 10 to 6, giving people access to care in the evenings and on the weekends. And we're delivering an integrated consumer experience. So scheduling, one site for all those services. You don't have to go to multiple sites to schedule dental or primary care or vision. You can do it all off of one site. And you think about an experience, take the mom, where you're going back to school, and I need to get my kid his checkup so he can play sports in the fall, and I need to get his shots, and I like to get his eyes checked, and I like to get his teeth cleaned. Well, we can do one click, one appointment. We can bring all those services together and bundle them. Interconnected solutions that bring and address the full health needs of the individual. So imagine an individual who comes in to primary care. Maybe in the course of that visit, they're diagnosed as diabetic. Maybe they were already diagnosed before they came in, but they've been uncared for, unsupported, what we would call unmanaged. Well, good news. We can direct them to a cooking class in the community health room that's designed for diabetics. And at the end of that cooking class, the nutritionist or the leader of the class takes that individual on a tour of the store and leads them on a healthy shopping tour to help them think about how they can better optimize and address their health needs in the food area. Oh, and they come to find out that because of the health insurance plan they're on, they actually get $30 in directed spend, which enables them to come and take that money and buy the healthy foods that they just learned about. So you think about those interconnected solutions. And then we think about the integrated care experience. You have primary care physicians and nurse practitioners and MAs and dentists and optometrists and audiologists and community health workers and fitness instructors, and they're all working together, and they're challenged with one thing: address the full healthcare needs of the individual. And we're seeing that come to life in the space in amazing ways. And lastly, it's about an integrated omni-channel experience. It's not about a bricks and mortar location. It's not about digital. It's not about care to the home. It's about all of those nodes of interaction coming together in an integrated way to more fully address the needs of the consumer and to deliver what we call consumer optionality. When you give consumers options, they will engage more. It's certainly the learning that we've seen from the programs that we've done with Pursuant Health and Higgy, who have delivered health screening kiosks in our stores. What we know is in a given week, there are more health screenings done on those kiosks than are done in the traditional system. But what's more interesting is the groups that are engaging the most. For example, men 35 to 55, the groups that are some of the least likely to engage in the traditional system. The question is, well, why are those men coming in and getting those screenings? Well, one reason is it's free. Men are cheap or frugal. I'm in the middle of that, so we're frugal. Secondarily, it's always on. You can come in anytime you want. Most supercenters are open 24 hours. So if you want to come in at 2 in the morning to do your health screening, do it. To do this health assessment, do it. But actually the main reason we actually hear that that men particularly are using them is that these kiosks don't judge. They just give you the facts. They give you some sense of what you might think about doing, but they empower you and they give you the control to manage your own health. And so again, what we see there is when we give consumers options, they will engage. So, I will tell you congratulations. You can now tell all your friends and your family and your coworkers and your neighbors that you have now visited the Walmart Health site in Dallas, Georgia. I'd still invite you to fly there and check it out in person, and certainly maybe take a visit with a therapist. All of you need it, I'm certain. And while I can tell you we're very proud of what we've done, I can also tell you we have a long way to go. Probably, unfortunately, a very long way to go. But it was important for us to start this journey. And what I would tell you is you really only need about 20 or maybe 30 minutes if you were to go sit in the lobby and just watch. And if you were to do that, what I tell you you'll see is you will see a customer who will walk up to one of our care hosts. And that customer will describe her issues and the challenges that she's faced in getting care for her and her family. And she'll describe how the system has failed her over and over. And you'll see a care host who will then begin to talk and say, well, here's what we can do for you, here are the options, here's how we can help. And in the course of that discussion, you can see a change in that customer's face, where you see relief pop up. And it's in that moment that you'll recognize this simple truth. It was time. Thank you very much.
Thank you, Marcus.